if you had ACL surgery, we're going to go over why 0 degrees shouldn't be your end goal after surgery. However, you shouldn't be striving for, let's say if your other leg has 10 degrees of hyperextension, you don't want to go too hyperextended, but you want to get as close as you can. So I'm not saying you want to go completely the same, but you want to get as close as you can the hyperextension over time compared to the other side. However, you might not have hyperextension, so that's a little caveat that we need to talk about. If your uninjured leg only gets to 0, then 0 is your end goal. However, most of the time that we see with athletes, they all have some slight little hyperextension, even if it's 1 or 2 degrees. And that's going to be the goal that we want to get to. And when it comes to that, like I mentioned early on, let's just get to as close as we can to 0. Once we get to 0, then we're going to slowly get some more hyperextension, because if we get too much hyperextension early on, that's going to be stressing the graft early on, because sometimes some surgeons, especially if you're very hyperextended in the other leg, they might limit some of the hyperextension of that knee with the graft site and everything. So you want to first get to 0, then slowly work your way into hyperextension.